Hi, I'm Dr. Karen Shaw, a part of the CSU Podiatry program, and we're here today to talk about a horse's conformation. I'm sure you've noticed no two horses are built exactly the same. And there's a saying which goes, function follows form, which means your horse's movement and performance is going to be influenced by its overall form or structure, which another term for that is a horse's conformation. Conformation, when we're looking at any two horses, is going to have a lot of variation horse to horse. There's a few parameters that might be more ideal, and then you might see some horses deviating from that normal or more ideal conformation. When we're looking, we have a horse here as an example today for us to look at, and we'll give you a few suggestions on how you can assess a horse's conformation, because it's pivotal for both your veterinarian and your farrier to have an understanding of how your horse's form or conformation can influence injury risk, your horse's movement, and your horse's performance, all based on how they're built. When we're assessing a horse's conformation, a great vantage point is where you're positioned now, standing in front of the horse. From this viewpoint, there's a couple of things we can look at. For one, if we draw an imaginary line coming down the long axis of the horse's leg, we can assess if there's any deviations of that limb angled inward or outward from the rest of the bony column. Additionally, we can look to see if the primary portion of the horse's limb might intersect that foot in an uneven proportion where there's more of the horse's load towards the inside or outside of the foot. When that happens, we can see actual distortion of the hoof, developing a flare away from the primary load. Additionally, not just having the limbs angled inward or outward, we can have a base wide stance or a base narrow stance, all of which can influence the horse's movement or the way they load through the hooves. When we look at this right front leg, we can also see that this limb has an external rotation outward, where the face of the knee coming down the limb is all angled in an outward direction. These types of conformational changes are going to influence your horse's movement and overall performance. Additionally, we can view the horse from the side to assess other aspects of their conformation. When viewing the horse from the side, there's a couple of different things we can assess for. One very important thing is you'll notice most horses, 2 feet, don't look identical. It's very common amongst horses to have one foot that's a slightly steeper or higher angled foot and a lower angled foot, which this gelding here demonstrates with this left front foot being a slightly steeper, more upright angle, with the right front being a lower sloping angled foot. This we call a high-low syndrome. It's important to recognize this because there's going to be slightly different areas of concern with both feet. For the lower angled foot, you're going to have a longer toe, so the point where the horse breaks over is going to be delayed. The more upright foot, you might see some other problems with this foot. For example, some horses with some navicular changes may have a more upright foot. So it is important when we're assessing not just the hoof angle. One, we have the angle and the slope of the hoof capsule itself, but we also have the angle and slope of the pastern, which is this region just below the fetlock. This pastern, as it interacts with the hoof, can have a different relationship. You can have a broken back angle where that pastern ties in with a lower sloping foot, or you can have a long sloping pastern and a more upright foot, which can have a broken forward angle. Understanding this relationship between the pastern and the foot is going to influence stress on different structures within the foot, as well as influence your horse's movement. When we're assessing a horse's hoof angle, there's certain things we can look at. One being the angle of the dorsal hoof wall, or the face of the front of the hoof. In addition, we can look at the angle of the heels. When we're assessing a horse's growth, every 30 days approximately, there's a ring that comes around, which is the growth ring in that last growth period. And depending on how a horse's feet are growing, you might see increase or decrease in growth depending on if it's a lower angled foot or an upper upright foot. We might have more growth at the heels and a divergence with less growth at the toe. This type of asymmetric growth pattern might lead to changes in the hoof structure. For example, less growth at the front might lead to a dish in the foot. Or if we've got a club upright foot, we might have wider growth at the heels, might lead to that high-heeled appearance with a flatter sloping coronary band and a more upright heel conformation. Understanding your horse's conformation can then be used with an understanding of different podiatry principles so that we can take wherever your horse structure is less than perfect, less than ideal, if there's abnormal load or stress on different parts of the foot or limb, we can then use different styles of shoeing to better support and protect those areas to prevent injury or overall improve your horse's way of moving.